Welcome to our channel. If you need to enroll in Medicare, follow these step-by-step instructions to navigate parts A, B, C, and D without confusion. Step 1. Understand when you're eligible for Medicare. Most people qualify at age 65, but some younger people with disabilities or specific conditions may qualify earlier. Step 2. Learn what each Medicare part covers. Part A covers hospital stays, Part B covers doctor visits and outpatient care, Part C is Medicare Advantage, and Part D covers prescriptions. Step 3. Enroll during your initial enrollment period, which begins 3 months before your 65th birthday and extends 3 months after. Missing this window can result in permanent penalties. Step 4. Sign up for Medicare. Part A and B online at ssa.gov by phone or at your local Social Security office. If you're already receiving Social Security benefits, you'll be automatically enrolled. Step 5. Decide whether to choose Original Medicare with Parts A and B or Medicare Advantage with Part C. Part C plans combine A, B, and often D into one comprehensive plan. Step 6. Enroll in Part D prescription drug coverage if you choose Original Medicare. Compare plans at medicare.gov to find one covering your specific medications affordably. Step 7. Consider purchasing a Medigap supplemental policy if you choose Original Medicare. These plans help cover copays, deductibles, and other out-of-pocket costs. Step 8. Review and update your coverage annually during the open enrollment period from October 15th to December 7th. You can change plans if your needs or available options have changed. Don't forget to like this video and subscribe to our channel.